So our knowledge of ultraviolet light and its effects on skin has been increased rapidly in the recent years. The bottom line is we really know it now to be a carcinogen, and if there's one message to take away is, a little is good and a lot is not good. What is sunlight made of? So it's visible and invisible wavelengths. Two of the invisible wavelengths are ultraviolet A and ultraviolet B, UVA and UVB. I'll probably refer to them through the talk. UVA is also known as black light. I don't know if you guys are all too young, but if you remember the 60s and 70s, that was the thing to have, and you had the black light posters. We still use this in dermatology because it's what makes things fluoresce, and we actually, for different fungal infections, we will show a black light to it. It'll also show skin aging if you look at your skin under black light, so you probably don't want to do that too much. UVA penetrates deeper. It's a longer wavelength, so it penetrates deeper and it has more energy, and it's what contributes or causes sun damage or aging of the skin. So if you and just to really give you an example of how significant sunlight ages the skin, it's the biggest factor for skin aging, and of course, smoking and alcohol also age the skin, but the biggest factor is sun damage. And if you can ever look on, where your bathing suit keeps you from the sun, that doesn't age like the stuff that your face and hands, which really get exposed to the sun. It also causes thinning of the skin and loss of elasticity, blotchy pigmentation. UVB is only 5% of sunlight, but it's also what stimulates vitamin D production, and it is a known carcinogen. Both UVA and B are carcinogens, but high intensity UVB leads to cataracts and vision loss and other vision problems. Common sun-induced skin changes, suntan and sunburn. Suntan is a result of injury to your skin. So the light induces the body's production of melanin, but it is a reaction to the light's injury to the skin. A sunburn is a more acute damage of the skin. It also causes DNA. It's also a result of DNA damage, and several inflammatory pathways are located. So, if you do get a sunburn, non-steroidals can help a little bit with the pain. There can be benign tumors which do not spread, but are not harmful except to your looks per se. And then malignant tumors which spread from and grow out into life-threatening cancers. So the most common cancer is basal cell. Basal cells are the deepest layer of the epidermis or skin, and this type of skin cancer is fairly easy to treat when detected early. So it can be various signs. It can be an open sore that bleeds, oozes or crusts, and you should be concerned about a sore that doesn't heal after 3 weeks. It could be a reddish patch, irritated, that may hurt or itch. That's probably the most common way I see it. It could be a shiny bump that's pearly or translucent. That's probably the second most common way I see it. It can be slightly elevated growth with a rolled border, or it could be just look like a scar, sun damaged scar, and those can be very difficult to decide whether they're just sun damage or skin cancer. So the only really way we'll be able to know that for sure is with biopsy. So a lot of people with a lot of sun exposure have a lot of these like scar-like areas on their skin, and that could be what we call an actinic keratosis, which is sort of a benign tumor, but can turn into cancer, or it could be already on as basal cell cancer. Squamous cell is, so the layer above the basal cell is squamous cell, and when that becomes skin cancer, we call it squamous cell carcinoma. It's the second most common, and again, it's caused by sun exposure. These are more often in the face, neck, scalp, bald, especially scalp if you're bald, or hairline is receding like some of us. They're thick, rough, and they're and when identified early, they're not serious, but they can be. They're more likely to become invasive and really can cause serious problems if they are not treated early. And melanoma now is the most serious and dangerous form of skin cancer. Again, it's 100% curable if treated early, but this has can cause has a significant mortality rate if it progresses and metastasizes. So the melanoma originates from the skin cells that produce melanin, and they're usually black and brown. So this is why, because of melanomas, this is why we pay attention to our moles. Because I think this is really important. What you're looking for in a mole is asymmetrical shape, borders that are uneven, colors that vary, larger diameter, and especially any changes. So any mole that's changing or growing, it should really be looked at by a doctor. Not all itchy and irritated moles are skin cancer, but itchy and irritated moles are more likely to be skin cancer. Okay, so be savvy about the sun. The best way to prevent skin cancer is to reduce your exposure. So reducing your sun exposure, stay in the shade, avoiding the sun from 10 a.m. to 4 p.m. Certainly avoiding direct sunlight. Sunscreen products, and you want an SPF, I would say 30 or higher, and then really the most important thing, and I wish, is broad spectrum. So a lot of people are buying sunscreen. About 40% of sunscreens bought on Amazon.com, which is actually one of the largest sellers of sunscreen, did not have adequate UVA protection, or did not have adequate water resistance. And so that's 40%. And so if you're buying a sunscreen the SPF is just about the UVB protection. So UVA, as I already explained, is also a carcinogen and also leads to skin cancer. You need to have protection for both, and so you need to make sure your sunblock or broad spectrum sunscreen controls against UVA. And then for children under the age of 6 months, they need to be covered in clothing. So clothing adds another layer. Some people who are either very fair-skinned or babies who have not fully developed their melanin, they have to be clothed. They can have sunscreen, but they actually have to have a layer of clothing. Direct sun can really cause damage. They're especially susceptible. Hat is a wide brim hat is very good for providing shade to the neck and face. Sunless tanning. The tanning beds. They're just they're just as harmful, and perhaps you could argue even more because you're able to give higher doses before burning. Now, sunless spray options are safe and can give you that tan if you want it, really are the way to go if you really feel like you have to have a tan. Yeah. Sunglasses are also important because you can get sun damage to your eyes. The biggest issue is cataracts. You want glasses that are going to give 90 to 100% UV protection, and the color and the cost of the glasses do not determine, how effective they are. A cheap pair will work just as well, and the wraparounds are the best. So early detection is the best treatment option. Please carefully examine your skin once a month. Look for changes in the shape and color of birthmarks, moles, and other skin spots. And if you notice these changes, seek care from your healthcare provider. This is more stuff about sunscreens. Apply it well, ideally before you get out in the sun. Reapply every 2 hours. Apply adequate amount. It takes to cover your body is like a palm full of sunscreen. Make sure check for expiration dates. Clothing is also a good sun block or screen, and extra precautions with water and snow. The most intense sun is between 10 a.m. and 4 p.m.